Eastern. It says on here, I said 8:30 p.m. All right, here we go. We are live. Eric and myself again, Matt Gluckman with Think Fitness Life. Today we're going to be talking about exercising after injury, or exercising during an injury, or overcoming chronic pain. Uh, it's kind of all the same sides, or different sides of the same coin in terms of, um, you know, identifying the pain, and then kind of reestablishing mobility and movement patterns so that you can get better neuromuscular firing and not result in pain, right? And the goal is to um, strengthen so that you're not in pain. And the best way to do that is the first exercise without pain. But I want to let Eric kind of start here a little bit in terms of um, most common injuries.
Well, I'd say first off, the most common injuries are lower back issues. And I guess first off is there's difference between injuries and pain. And I think there
Mm,
needs to be a differentiation between the two because if you're seriously injured, you're going to have some sort of acute damage. Now, you can still be injured and have pain and vice versa, but it's not going to be one of those that are like lingering. I mean, I always assimilate when it comes to our athletes or my clients, an injury is a torn ligament, is a torn tissue, is something that
yeah.
is abruptly disturbed in the system where let's say a compensatory pain or a tight tissue that's giving a perception of pain is completely different and it's not really an injury. So and then on the lines of that, think like your itises, your tendinitises, your bursitis. I really don't consider those injuries. I consider those more on the compensatory pattern side of you're overusing a muscle. Now, yes, you can have overuse injuries, but I always like to have people understand that there definitely has to be a difference between you're injured or you're hurt. Because I remember one of my football coaches way back then being like, hey, if you're injured, that means you can't play. If you're hurt,
Hmm.
that means you can manage it. And we are always hurt most of the time. As athletes, as humans, we get tight, we get, toned up, we run into issues, we get bruised, we get bumped. It might not even be in the weight room or sports. It might just be something that you walk in and stub your toe. Yeah, you're hurt, but you're not injured. It's not going to limit you. And first of all, I think that's a big thing for a lot of my athletes is that psyche of you might be injured or hurt, but you're not like it's not going to stop you or slow you down. And a lot of times when we do have injured athletes, the first thing they do, oh, I'm injured, I can't do anything. Well, it
Mm.
depends on what's injured. If you have one leg that's injured, yeah, you better damn right we're working out the other leg and getting some upper body work in and still pushing because taking away a person from what they do is not a good thing. If I'm injured and you take away a weight room from me, my psyche's not going to like that. And from a mental health standpoint, for a lot of athletes returning to play, it's a no-go. And I assimilate that to the general population too. You can't take away something that they like to do. If they like to ski, you got to let them have that. You can't say, hey, you can never do this again because you're injured. No, it's not good. So to understand if you're injured, you have a damaged tissue or damaged bone or whatever,
Mm.
there's way to rehab that and get back to your sport, to get back to fitness, to get back to your lifestyle. And I think that's the important thing is to tell people that you're going to work through this. If someone has lower back pain, one of the most common things we see in the gym, I'm not one to go away from that lower back. And years ago, when I first started out, I'd be like, okay, we got to take away all the exercises that lower back potential. And I tell my clients, you need to figure out how to engage your glutes, your abs, your hamstrings, your quads to stabilize the lower back, or we're going to run into the same problem over and over again because you're not changing anything by avoiding it. If I want to get good at long division, am I going to go just do multiplication all the time? No. And I think that's where a lot of athletes and people go wrong with their programming or their return to play protocol, if we'd like to call it. They avoid what's bothering them instead of addressing it right off the bat. When you address things off the bat and start to ease back into it with movement patterns and allowing certain muscles to fire, you're going to get the best results. And usually with injury, that's what happens. If you're injured to tissue, there's a disconnect between the neuromuscular and system and the firing pattern. You need to restore that through multiple different ways.
I want to unpack a few things. I love that you started off with differentiating between injury and pain because I think so many people, and as a coach, as a trainer, like when someone tells you they're hurt or they're feeling pain, you do have to first thing is to just pause and dive into it a little further and get a little bit more nuanced because you know how many times that people tell me like, ow, ow, that hurts. I'm like, once I've gotten more established, like, okay, is it a joint or is it muscle? Like, oh yeah, the muscle's just burning. This is a hard exercise. I'm like, geez, give you like kind of a minor heart attack, But then, yeah, like an injury is true ligament, tendon, muscle, tissue damage. And I think when we think of falling on the ground and scraping our knee, we sometimes think of that as an injury or like even bruising. Like I've seen people like butt knees together in a sporting event, and then every time that athlete goes and steps, they're feeling pain. Now, did they do any injury, any tissue damage? Not like 99% of the case, probably not. They probably just did bruising, and they're feeling that bruising every time they go to put pressure on that side. So it makes them really fearful and afraid because we have a survival bias. It's a good thing that we are afraid of pain that it could stop us from getting to that injury. But what we need to do is treat that as a signal, which it is, of how to improve that. So, where I'm going with this is, let's work with lower back pain for a second. And let's say that I go and pick something up. And every time I go to hinge, which is essentially picking something up off the ground, I'm hinging at my belly line, my waistline here. And I'm actually just using my lumbar spine vertebrae to flex and extend. And I'm not actually flexing at the hips. So now I'm here it is. I'm doing this bad movement pattern so many times. And then I did it one time that got me injured. Well, now I actually have like a little alarm system in my brain. You can think of the game Operation. So now if I'm going to try to retrain this movement pattern up and I feel pain, I'm doing it wrong. So how can I do this movement pattern and not feel my lower back? And that's when you get into the reprogramming of your neuromuscular system and relearning different patterns so that you're getting out of pain. It does you no good to play through the pain just because it's not that intense, because eventually it is going to be that intense. So I think, that's where I want to kind of take things a little bit, is giving people real solutions that they can use to overcome hurt and not an injury. I think that's a really clear distinction, because we're not necessarily going to, there could be something more serious going on. I guess what I'm trying to say is I don't want this video or our coaching here to override the reality that there could be some real damage going on. You may have to get checked by a professional. You might have to get an MRI or an X-ray or something to really see the true damage that's going on. But if you're just having hurt or a familiar pain that has come about over and over because, oh, I squatted again, I feel this hip pain every time I go to this weight, and that's different. That's more of a hurt that we can overcome with different patterning, with different activation exercises and different bulk strengthening exercises, so that we're strengthening the strong muscles in the right movement patterns.
And even if you do have an injury, a perceived injury, now we always say you have to go see a professional first, go get it cleared, get an MRI, get an X-ray, consult a doctor, because most of the time what happens, you go to a doctor and they're going to say, okay, you have this. Let's say it's an ACL tear. We'll go kind of to the extreme here. You have to get surgery. You have to go to PT. A lot of these techniques and exercises are going to be done in PT. So these will kind of have a lot of carryover. Now, this is not saying that if you have an ACL tear that, this is going to replace not having that repaired. There are some surgeries or some injuries that you don't need surgery for, that you can kind of as we're older, a lot of times right nowadays, if you tear an ACL and you're, I think it's 35 plus, they're not going to advise you to get surgery unless you really need that ACL. But you can manage not having an ACL by doing a lot of these techniques and these movement patterns to help you recover. Because a lot of the times after someone goes to PT, that's when they come to see someone like us, where it's okay, hey, I need retraining. PT is only going to go so far because they're going to give you baseline exercise. And one of the whole goals of Western PT is to get you out of pain. Once you're out of pain, hey, guess what? The insurance companies don't care about you anymore. They're just going to be like, all right, you're done. We can discharge you. Here's your exercises. Go. And most of the time, within 6 months, that person's back in PT because they didn't follow the exercise program or wasn't efficient enough. And that's where I always get frustrated, because generic PT without understanding human biomechanics, a movement is not a movement. You can't just perform a squat in any way and expect muscles to fire. It's the F word. You have to feel things. And if you don't, you're wasting time. And there might be people listening that are going to PT right now. And I'm going to tell you, if you don't feel muscles working together, you are 100% wasting your time. You're wasting your time going there. Most likely you're not going to get better or optimal if you're returning to sport or play. And that's a hard thing that people get frustrated with general PT. And I know PTs mean well. It's just the learning system as we go through. So these techniques and exercises are going to go a long way. I use them with all of my athletes, my clients, runners, lifters, soccer players, athletes, and there's no different buckets. All these are based on the human mechanics, so they can work for any athlete.
And a lot of them are geared at activating and strengthening smaller stabilizing muscles. You know, for example, with the lower back, usually it has to do with weak external rotators, and then my hips aren't and glutes aren't doing their job, and my lower back kicks on to stabilize my spine. And we do something as simple as like a clamshell exercise, which I'm sure people are very familiar with, where I'm having bands on my legs and I'm on the ground and I'm pulling one knee apart. Here, I can just demonstrate really quick, where I'm in this side plank position, I'm doing a clamshell, and I'm activating. What's the exact muscle I'm activating?
Well, so I'm not a big fan of clamshells. And tell you the truth, I hate them because there's a right way to do them and there's a wrong way. It's not a bad exercise.
I think oblique, you have to recruit oblique with the clamshell. I think a side plank clamshell hold, like bar none. If I'm having lower back pain with somebody or hip pain, that will make it go away. And then having them squat with the band, because then we have to get them into a loaded position, so they're overloading those muscles and they're getting a training effect out of it. So okay, so you disagree with it, but what is that muscle?
I don't disagree with it. I get a good position. So if you have an extended back in that clamshell posture, which I see with it a lot, or even a lateral band walk, that you're not going to do anything because the glute maxes are already out of position from an external rotation position of a pelvis. So you're not going to be able to access the range of motion. So you're going to have to revert to the lower back for stability because the pelvis can't move. And I think that's where people get in trouble when they just see these exercises and they're like, oh, I can mimic it, but it's very specific on what we're looking for from a spinal position. So I think the clamshell exercise is great, but I have to get you in the right position, because then you're going to feel outside glute max as an external rotator fibers. You're going to get some bicep femoris as external rotators too, not just, hey, I'm just feeling TFL and IT band. Same thing with the lateral band walk. So I never disagree with an exercise. I just want people to know that there's exercises out there, but you have to be very careful of how you perform them, because I've had people lie in side lying position, and if their back is an extension, they're never going to get a glute max on when their leg goes into extension and behind them. But as soon as I get abs on, that outer glute will turn on. And you ask any runner out there, when I put them in that position, they'll feel their right glute max, and it's going to be a game changer for them.
Yeah, and the key is really, you're doing any of these things, again, as Eric said, tuck your tailbone down. That's how you make sure that you're already feeling your core, your pelvic floor is on, and your glutes are engaged. So you're already in a good position with your spine before you're turning these muscles on. And that should go, yeah, like, I mean, we could say that about really any exercise. Like, you can Google anything, but some of the nuances, that's kind of what the whole idea behind coaching is like. AI is not going to be able to take over our jobs. I will argue that to the death. Like, it's just not going to. Like, again, you can Google the best workout programs, Google the best protocols for XYZ, but progression, regression, nobody can do that except a human being watching and seeing things move. Because you can actually have like a functional scoliosis where, oh, as soon as I go to a standing position where I'm axial loading, now all of a sudden I'm having these bad movement patterns. So, I think, kind of piggybacking on Eric, I don't have anything wrong with PTs, but PTs really don't know the body in motion all that well. And back to really quick what I was saying here with the side plank clamshell, that exercise is going to help turn on these smaller muscles so that when I go to do a larger muscle pattern, like a squat, like a hinge, I'm going to recruit my glutes. If I can recruit my glutes into a hinge, well, now I'm actually engaging my core better. If I can't feel my glutes in a hinge, I will definitely not feel my core. The reason this is important is because we have 7 primary movement patterns. And a lot of these little activation exercises are not part of our 7 primary movement patterns. Again, they are there for turning on the smaller muscles so that when we do one of these 7 primary movement patterns, we get a training effect and we reprogram the neuromuscular firing in our system. You have to remember that all of our muscle is connected together and we are one big pulley system. So, covering lower back, do we want to talk about some more specific exercises? Do you want to talk through about getting out of lower back pain and retraining for better firing?
And I think you mentioned a good thing, and people see this often, are bands and balls. And bands and balls are good things, but they're also bad things to a degree. Eventually, you have to get away from using bands. And I think another one of I'm not going to disagree with it, one of my things I see gone too far is squats with bands around knees, because people then become reliant from a neuromuscular standpoint on something pushing their knees in so they can push out against. We need to understand that when we're playing sports and doing other things, that we don't have external load to press against us. That's one good thing that weight training allows us to do, is understand external load. But we can't put a band around us when we're in the middle of a basketball game, be like, okay, here are my glutes. Eventually, what people need to realize is they have to find glutes in standing position. Yeah, it's one of those, like, it's a good tool, but eventually you have to take them away. Just like supine and side lying, eventually you have to get someone upright. And that's a tricky thing, because then people start losing sense because they become reliant on these things like bands and things between their feet or things in their hands that they need to touch, that it needs to get progressively away. So in someone's even workout training program, I very rarely will put bands around after the second week, because they need to find movement options with their own movement in their own body.
Yeah, and I think we're definitely splitting hairs more with the athlete side, and I think we have more of an audience around general pop, but I think the key takeaway that we learn from athletes is that, again, training better instincts. I'm not going to make it so that literally every step you take, you're like actively thinking about what your hip and knee and ankle are doing so that you're making perfect steps all throughout your life. It's not about that. It's about you spend all that cognitive present energy when you exercise, so that when you and overload properly, so that when you go back to your regular living, you can move freely without pain. This is how you get out of pain. It's not about a conscious, like, always fixing this problem that you're going to always have, but it's about correcting it in the right modality, right? Sympathetic nervous system on, training for an hour or 25 quality reps, and then we've overloaded our nervous system, and it's time to shut the nervous system down and get parasympathetic for the next 24 hours. And then you can go again. And each training, you're like layering a new brick to better movement pattern, better neuromuscular firing, so that you're not adding to the problem and you're getting your body to move without pain again.
Yeah.
So really quick, like with lower back, I do like to start people on the ground. You know, we can do something. We'll start on the back, stage the progression. I think the first thing is just like a hip flexor inhibition. You know, simple hold just like this. You can do 10 breaths. We got to think that when I breathe, I don't want to make it like that's not 10 breaths. This is a breath. That might have been like 6 seconds. So I want you to have 10 breaths like that. Again, you're just training your body to be in aerobic state whenever you're doing these positions, so that you're training your body to click save on the muscles being disengaged. So this is like a hip flexor inhibition. Also kind of doubles as a glute bridge activation. Next thing I'd like to go to is like a tabletop position, hands and knees. We can do something simple as a cat-cow to just get more mobility out of our spine, kind of a little spinal reset for alignment. And then I want to start doing things like a bird dog. It starts training our core in this position, so that when I go to stand and I do something that was usually causing my lower back pain, like looking to pick something up, my core is going to be more engaged to do that, versus kind of falling back into old bad patterns. And I have this, you know, despondent core, not responsive core, and then just adding to the lower back pain again.
Yeah. And a lot of that stuff is I know we're said athletes, but athletes get things pretty good. I think it's more important that the general pop understands and finds and feels these movement options, because they're the ones that are more disconnected from their body. So it's really paramount that where something like you're doing a glute bridge or an let's say a bird dog, where opposite arm, opposite leg, that you're still feeling glutes and abs work. Because if you don't, I would say you're just wasting your time. You're just going through the motions, and then any lift you do afterwards, it can be detrimental to that training program because you're not sensing things. And I think this is where a lot of people do get in trouble. And it's hard. It's not easy. And that's why you said, like, you do need a coach to have you understand what you're feeling and what you're going to sense. Because just doing a squat with no tension is not going to get someone far, and teaching someone how to understand the force tension relationship that we're looking for.
And here's another exercise, is the Palloff press. Doing this with a breath on each rep. You're going to feel your glutes. You're going to feel your core. Like Eric said in the beginning, what's my hip positioning? If I'm someone who's dealing with lower back pain, what's my hip positioning in all these exercises? If I'm trying to correct it and have my hips more neutral, then I need to always make sure that whatever exercise I'm doing to overload my body and get a training effect from, I need to have my hips in the right position. So tailbone's tucked underneath me. I should already feel my core. You start to do reps like that. You can do 10 breaths, a rep per breath, 10 reps on each side. That's another great exercise for strengthening and getting out of pain. But unless there's another one that you'd like to add for lower back, let's move on to either knees or hips.
So it's kind of funny because all this is intertwined. You know, if there's a lower back exercise, it's going to be a crossover to knees and hips. You can use a lot of different techniques for knees and hips. Now, the knee and hips are kind of tied together, because if you are going to have knee pain, it's probably a hip problem, most likely. Same thing with the ankle. It's probably a hip problem. But to kind of work at the hips is you're going to try to focus on repositioning the pelvis. Like, that's goal number one. So whether you're standing, sitting, side lying, you have to find that position of, can you tuck under and sense glutes on? And at first, no movement is sometimes the best therapy to teach someone how to isometrically hold and control and inhale and exhale as they're moving through space with that breath, right? Because as we're breathing, we're still expanding rib cages and compressing organs. Sometimes with just breathing, people can't control that. So sometimes too much movement is actually a bad thing. But the end goal is also get to movements. Now, if we have knee pain, let's say it's anterior knee pain, and most likely as your quads are going to be tight because your hips are out of position, then you just focus on working that quad, glute, hamstring, ab connection. Like you need to find those muscles working together to decrease the demands. And then you can start doing things like masculine dual, which is terminal knee extension, where you're activating the quad glutes in a position where you can now actively fire them. And with knees, it's tough.
You mean hamstring glutes?
Well, quads, glutes, hamstrings, at all.
Yeah, well, I know you said where you're activating quads. So I'm just making sure people realize they're trying to feel more of the back of the leg on this one.
So on that one, the terminal knee, it should be more actually quad to extend the knee. So you're pulling back with the hip, but that quad should really actually give the terminal knee extension, is that quad finishing it out, where the hamstring's more stabilizing through.
Yeah, but see, I disagree. Like, especially if someone has knee pain, like usually they can't feel their hamstring. So I actually use this as a way to make them feel their glute hamstring connection, so that when they go to do something, it's not all quad and they're not in the quad dominant position and they're not adding to knee tension.
So you should still feel the glute hamstring.
And that's all my point was. I just wanted to specify.
Dominant. But I tell people to be careful on that one, because if they don't feel their glute hamstring, it becomes a very quad dominant exercise and they start overdeveloping. I think that's where I think it's not a bad thing, but I always think it's a quad dominant exercise, but you have to have glute and hamstring on the backside, or you're just going to be wasting time. And you can see that very readily when someone has a band around and they just let that band snap that knee forward and they're not controlling, because as the knee goes forward, you're getting eccentric quad. You're going to lengthen that quad and eccentrically. So it's still activating to slowly lower that knee forward to decel, with that hamstring is also letting that knee decel too. And another good one with the band is another one is if you're doing like an single leg position out of that, you're using the band to decelerate the leg going back, so you're getting more glute hamstring. So there's
like
two exercises.
A single leg hinge.
With the band still going in that same direction, that's glute hamstring in a different position, but it's decelerating the knee from getting terminal knee extension. So there's
too much extension.
Mm-hmm.
Yeah.
So there's two mechanisms. So you kind of want to do both of those techniques if you really want to, because we're front side, back side. You can't do just one and be all quad and no glute hamstring. So it's very important to have that. And then there's the concept of knees over toes. And I'm sure if you heard of the knees over toes guy, which is
And I was going to say, that's the purpose behind making sure that you can feel the hamstring in a simple terminal knee extension, because I want to get you to be able to collapse at all three of your joints, ankle, knee, and hip, without knee pain. And in order to do that, we can do something as simple as I like the knees over toes guy, but not everybody has to get insanely far over their knee.
I agree.
What I'm trying to get though is that most people will do is something as simple as like a front foot elevated squat, and they'll let their heel peel off for pure idea of driving that knee forward. They're not realizing that their only way of controlling force is through the ball of their feet. They're not using really that whole foot. So if you can keep that heel down and you have the whole foot evenly distributed with your weight, now you'll be able to collapse down, use all the muscle rather than the joint. You should be able to move freely through this range of motion without any knee pain.
And that's where people get it wrong, because they take a concept that's good, but that's level like 3 or 4. You got to do base level things first. And I think that's where a lot of people miss it. They're like, oh, knees go over toes. It's like, yes, but you have to have control position first of a pelvis, a hamstring, a glute. If you don't have that, you're just throwing garbage at your program, because you're going to end up getting back into over quad dominant things and you're going to lead to knee pain. And that's a hard thing when it comes to this world of quick bites on Instagram. All you see is something like that. And you're like, oh, I got to go do that. And there's some person that really doesn't have the capability or the movement options to do it. They do it. They're going to actually hurt themselves more. So I always tell people, be very careful. But the end goal is, yes, your knee has to track over your toes with good foot mechanics. And then eventually, yes, you can pick your heel off, because that's running.
And shoot for your middle toe.
Mm-hmm.
So I agree. hips and low back pain are pretty synonymous, and also with knee pain, there's a lot of carryover. There's a lot of it has to do with just hip positioning, pelvic floor control, glute and core strength together. But then another one that we could talk about is definitely neck. Neck is a little bit more related to shoulder and upper cross and lack of thoracic expansion.
Yeah, then that next good one, because it's funny because it's all tied to the axial skeleton. So you have a thorax is basically going to be your up top, and if that doesn't move or rotate, your neck is just another appendage. So you have two arms, two legs, you have appendages, and then you have this appendage with the neck, and it's going to house something that's very important, which is our brain, and everything reacts from the brain. So when the neck gets tight and we see neck pain, usually it's a sign of compression. That means you're losing movement options somewhere in the rib cage, which means your shoulders are probably going to be absolutely junk. So when it comes to neck pain, I don't look at shoulders. I look at rib cage and I look at mandibles. So I look at people's teeth and what people's jaw is doing, because that's going to tell you a lot what the neck is going to try to do around it, because we need to have this lordotic curve of our cervical spine. And with nowadays, we're starting to really lose that with computers, forward head posture, lower backs that are too hyperextended, push necks forward into forward head posture, and we lose position. We get tight anterior necks. So a lot of it is understanding then the breathing mechanics. So as people start to breathe, they use their neck muscles to pull ribs up to try to pull air in, because they just don't have a right pattern. And this kind of comes with just being human, but then with poor activation of movement options. And we see this all the time. A lot of it with my population is when you do a rotation and your head and neck goes with the rotation, that can be a very bad thing, because now you're using your vision and your neck to try to turn instead of your abs. So I tell people, swing, keep the head straight, and you're getting neck on thorax or thorax on neck rotation to allow for optimal movement. And you watch anyone in the gym do this with any sort of rotation, their eyes are going to go with their body. And we got to dissimulate that so they can start turning on top of each other.
People forget that the head is still an extension of your spine, and alignment is good strength. Like if I want to be a strong deadlifter or a strong squatter, like I don't want to be in this like collapsed position or this muted position. I want to be tall, and I want to get to that tall position, especially if I'm coming up from like a clean. I want to eventually get big, and there's no bad position except for the one you can't get out of. And usually neck pain stems from being able to get out of a position with your thorax. And, you know, a lot of what I see in general population, adding to what Eric's saying about computers and even carrying backpacks. Like, geez, I remember learning later that you should only carry like 10% of your body weight in your backpack. I definitely broke that rule, you know, back in the day. But what you're doing is you're creating this upper cross, and then you have this kyphosis in your back, this upper cross in your shoulders, and now you've lost all thoracic expansion. Really, the only reason I talk about shoulders is because it's the most easy way to understand this concept. Is I want my shoulder blade to stabilize to my rib cage. That's going to be like the platform. We talked about the hips and lower back. We talked about the pelvic floor. Think of the rib cage as like the pelvic floor of your upper body. If I can get that down, now my shoulder can articulate properly, and I'm not going to recruit things like the muscles in the neck and the upper trap, which just add to more tightness. So if I can stabilize, first of all, it's about getting open first, this thoracic expansion position, and then from there, my scapula being able to sit nicely on my rib cage, and then I should be able to get out of neck pain. And then we can talk about strengthening and overloading these positions so that I'm not always having to fix and wake up with knee pain, or excuse me, neck pain.
Yeah, it could be knee pain too, right?
Yeah,
if necks are tight, right? And I was
pendulum theory.
Yeah,
right.
You're gonna have, if necks are tight, I guarantee you someone's abs are not working. I don't care if you have a six pack. If you got a tight neck, that means your abs aren't working as exhalation muscles to control the rib cage. And when we have those ribs come too far into external rotation, you're gonna be kind of stuck. And that's where you do need, to train the serratus anterior to pull that scap to the rib cage And as you exhale, ribs need to go back. Kyphosis through the thoracic spine is a good thing. We need some degree of that. If you're too kyphotic, then that's going to lead to a flat cervical spine. Then you start seeing really kyphosis because someone's trying to use their anterior neck in position to find their abs. And that's not a good thing because then everything's going to become tight. Glossal muscles are going to get locked up. Teeth will get locked up. Things will start going awry. You'll get TMJ, headaches. But a lot of it stems from the rib cage and having good postural control and breathing mechanics of abs, and then allowing those shoulders to move. Because if you can create a neutral position to move left and right and forward back, you're going to have shoulder mobility. You're going to have range of motion. You're going to have movement options. And then you can free the neck, because an unfree neck is not a free body. If you have a tight neck, there's no way that you're going to get anywhere close to having a body below that's going to be at its optimal performance. You're going to have compensatory mechanisms somewhere because you'll lock it up, and you'll also lock up your sympathetic nervous system, which is going to put you in more of a high stress state constantly because you're just running on high drive.
And I'm just kind of demonstrating what Eric was talking about, finding these movement patterns. I like going left, turning left and right. I like turning ear down to the side. I like going chin down and rotating up and looking at the ceiling, maybe 5 of everything. And then I also like counterclockwise and clockwise circles, all of that to get the mobility that you need before you're going to go into really strengthening other muscles and activating certain other muscles, so that you're not using the wrong ones to breathe and to engage your core, and you can actually sit in the proper position and actually move up appropriately. Again, the body's one big pulley system, and we have this joint by joint theory. So there's a joint that's mobile is connected to a joint that's stable, and so on and so forth. And then there's a pendulum theory where if I have my center of mass, say the marker's the center of mass, and if my head moves forward to that center of mass, it means something else had to move behind that center of mass. So if I'm having a forward neck position, odds are now my hips are in a bad position, my knees are in a bad position, and my ankles would be in a bad position. So what's funny is, sometimes people have multiple of these things going on. They're like, oh, what should I start with? You got to do them all. You're literally trying to do them all together to get out of these painful patterns and start to create new patterns that are going to create, allow you to perform and feel good. And, whether it's exercise or walk or get out of bed or play with your grandkids on the ground, you want to be able to do all those without pain. That's the goal.
And if there's one place to start, it's got to be the neck. You got to clear up the neck because that runs the central nervous system. But if you have ankle pain, I always see this. People start with the ankle. You're wasting your time. You always need to start at the core. You start with the pelvis and the thorax, and then you start going elsewhere. If you just do ankles and knees and shoulders, you're not going to get anywhere. And I think that's where a lot of people in the lens of PRI world understand, but in the non-PRI world, they don't, because you're looking at it from a joint by joint position. It's like, oh, I'm just going to work on the hip. You know how many times, oh, the doctor said I had hip, tendonitis. Ooh, that's great. Well, I guarantee your pelvis is off and it's causing that. And there's a plethora of thing that's going to go. And usually as you go, you start taking away someone's pain, right? Or hurt, their compensatory patterns are going to start putting that somewhere else. And you're going to follow the chain, and it's either going to end up in the lower back or it's going to end up in the abs and obliques because it's a pelvis thorax issue at first. And so that's where people always need to start rather than starting from distal to proximal. It's got to be within to outside.
And itis is just a fancy word meaning inflammation of the. And most of the times people are so scared of hearing this tendonitis or whatever that they were diagnosed with. They go consult with the surgeon, and if you go to a barber, you're going to get your hair cut. You know what I mean? Like, you go and consult with the surgeon, 9 times out of 10, they're going to try to promote surgery, right? That's what they know how to do. And another piece that I wanted to throw on here was just an overhead press. I think it's such an underutilized exercise and done so, improperly. So many people start an overhead press from up here, and it's a lot of tension on my shoulder. And if you're just focusing on feeling the arm and the shoulder, they're trying to just feel all their anterior delt or their lateral delt, but you really want to be down here. You want that scapula. You want to feel that little muscle here, that your serratus on your rib cage, and you want to feel like your scapula has something to push from. Now you're pushing from that rib cage, and then when you come down, you come all the way down to that position again, and you're going to start strengthening that platform that we talked about, that your scapula should be sitting on, so that your neck isn't doing the job of what your rib cage should be doing.
And especially with the overhead press, you see this all the time, and even bicep curls. People extend their lower back. Extension of the lower back will give you more range of motion, but it's not true range of motion. Now, some sports need that range of motion, and I'm okay with it. But most of us are not in these sports where they need excessive back lordosis, and they're just going to hurt themselves. So people getting like, oh yeah, I can go overhead, but they're like arching their back. Yeah, eventually you're just gonna tear apart your shoulder and not get anywhere. So the rib cage position of an exhaled rib cage down and then moving to really allow serratus for upward rotation and movement, like that's the key. We see, especially in seated shoulder press, right? People will arch their back to get leverage and momentum. That's just not a good technique to have.
And that's why I hate that's why I hate isolation work. And like literally everything we talked about today could be incorporated into one workout. Like you should be inhibiting your hip flexors, recruiting your glutes, your obliques, your pelvic floor, your core, your what's the word? Like your rib cage loading, like all these things play a role into your warm up, so that when you're exercising, you're incorporating all these things. I'm not robbing Paul to pay Peter. I'm not pressing a weight overhead and forgetting all about my glutes and my core. No, that's why we started kind of with the center part, because the core is the most important part, right? All the appendages attached to it. If I don't engage my core, it's like firing a cannon out of a canoe, and I'm going to get injured or cause more pain. What I want to do is anchor everything down to my core, and now any exercise I do is going to help improve my neuromuscular firing in a structural way, in a functional way that's going to help you move without pain. Another thing that I want to say is I love the phrase, you got to feel it to heal it. I think so many times, and I can talk a little bit from experience on this, like I have ulcerative colitis, and part of that trauma in my nervous system was that it would constrict a lot of musculature on my left side, and it would cause an SI pain, lower back pain. It was just like when I was in a heightened state of stress. And anytime I would squat in a submaximal load, I would have that same exact pain pop up, or deadlift in a submaximal load, that pain would pop up. And I had to go to a point where I couldn't feel that pain at rest. I couldn't feel it like just on the ground, but I had to find it. I had to feel it in order to heal it, in order to correct and turn that muscle off and disengage that muscle. And then I had to go back to my heavier lifts and move with proper firing. So for me, it was just different activation drills, and then I was able to lift heavy and go back to these modes where I was experiencing the pain and go through them again. And I think that's such a big distinction just in the mindset and the perspective behind, like, oh, here's an obstacle, I'm going to avoid it at all costs. Or here's an obstacle, I have to go through this. This is my next Everest that I need to conquer. And, so feel it to heal it, but then also be a buffalo. When there's a storm coming, cows actually run away from the storm, which in essence is actually just prolonging the storm. But buffalo, they run through the storm because they recognize that if they go through the storm that's approaching, they'll get through it quicker.
And I do like when you said like the isolation work and about all those different things. And this is kind of what I usually get a lot of people on, and it kind of blows their mind, is we could take a simple strength training exercise and I can get all those things in one. So if you want to do a seated shoulder press with your back against a bench, I can shut your hip flexors off. I can turn your abs on. I can get knee pain to go away while training serratus and shutting the anterior neck down and moving a weight overhead, because it's all due for position. If you get someone in the right position, I can make a bicep curl become a rehab exercise from shutting hip flexors and neck flexors off with certain movements. And it's not really, if people heard bicep curl, it's not about the bicep itself. I'm just adding a movement to it. It's the position I'm putting someone in to allow them to move through space is what's going to inhibit and facilitate certain parts of the system. So every exercise can be a rehab technique if you want it to. And then,
are you talking about a single leg balancing bicep curl specifically?
no, it doesn't. It doesn't have to be single. It could be.
I thought you were referencing one exercise, so I was just throwing a guess.
No, I mean,
I
could reference. I was referencing just that exercise. I could take any exercise. I could use a bench press out of a dead bug position to shut someone's hip flexors off. I guess what I'm getting to, it's not a hard thing to do. Just understanding the concepts, and that's where coaching becomes very prominent. And I think a lot of our clients stem towards our coaching because we go into that detail and because you need that detail. If someone has a coach out there, a trainer is like, all right, just do push-ups, but I'm not really going to care where your scaps are on the rib cage or your pelvis is or your abs are. They're not helping.
It's pointless.
Yeah, you need to
adding fitness on top of dysfunction.
Right, and you're not going to get it. Yeah, you'll get stronger to a degree, but the end goal of our system is to flow in and out of certain states, from parasympathetic to sympathetic, from rest, digest to happy to sad. Like, we're supposed to go back and forth, and certain things in this day of age just lock us up. So if you don't have that kind of insight into your body, like, that's where we come in. That's where we can see what kind of movement patterns you have. We can take certain exercises, base exercises. Some people might consider them isolation exercises. Yeah, I don't like them either, but we can use them that they become more than just isolation exercise. They become a core, they become a breathing, they become an overhead movement all in one to understand how to move through space when you don't have weight.
Yeah. And just to kind of piggyback on that and wrap up here, that's exactly what we as coaches do. We've been doing this since 2012, and we pride ourselves on the ability to get into that nitty-gritty detail to program for someone's warm-up so that they are inhibiting the right muscles that make sense for them so that they're going to get the most out of their workout. And we always also incorporate some type of specific cool-down function so that we are somewhat resetting the neuromuscular tension that's left in our body, getting into parasympathetic mode, and allowing our body to recover in a way that we don't have to stretch for an hour every day before our workout. We're trying to train for better instincts here. And the goal is across the board between your cardiorespiratory system, your neuromuscular system, your digestive system, your neuromuscular, your central nervous system, hormones, metabolism. We're trying to create synergy. So better product with all of them working together than just the sum of their separate parts. And there's anything else you want to say to wrap up?
No, I think for a lot of it is just understanding that there's injuries, there's pain. It's going to take time to work through, but don't just do nothing, because when you return to an activity, you're going to have that pain come back. You have to kind of attack what's nagging you and what's bothering you to understand and how to change that. That's the only way our human body learns. It's built for survival, and you have to change a stimulus to get a different outcome. You can't just take something away and expect a different outcome to have. And I think a lot of people get in that mindset because that's just how the world works. You take away a stimulus, something should just go away. I can repeat and go back to that same stimulus, but that's just not how the human body works. So be cognitive how you feel, address what's going on, whether injury, hurt, tight, whatever that is, address it, and then you'll feel better and better as long as you keep addressing it and have the right programming.
That's it from Think Fitness Life. Remember to feed your brain, move your body, and go live your best life. We're here if you need any coaching advice or programming. And we'll also have our Facebook training community you can check out, as well as our equipment giveaway contests. And that was from Matt Gluckman and Eric Menchie, Think Fitness Life, signing off. Catch you next time.